So, again, tonight we are going into chapter 6, and chapter 6 focuses on CPT, which CPT stands for Current Procedural Terminology. In this book, you are going to be coding for surgeries, office visits, or any type of service that is provided to the patient. And then we'll also take a look at the HCPCS book, which the HCPCS book is going to be coding supplies, excuse me, drugs, equipment, and supplies. So that would include like your durable medical equipment, your crutches, your walkers, your CPAP machines, your nebulizers. That is what is considered equipment. So when you look into your CPT book, and as I said, I'll go through the lecture first, only because it has about probably 60 slides, and I want to try to get through all of them. And then we can kind of go back and look at the layout of the book. Um, so this book is published by the American Medical Association. Um, and this is with code sets to report healthcare services performed in the United States. So other countries uses other types of coding systems, also other services. This is a medical, meaning your surgeries, your office visits, for clinic visit services. But the dental service line of healthcare has their own set of codes that they use for their services. Um, So it's a lot involved in coding, but we're focusing on this part of coding because this is what the CPC exam focuses on. So just a little bit of history on CPT coding is that the first CPT code sets were developed in 1966. That's a long time ago, right?
Yeah.
Right, Ma Kathy?
Yes. Okay, all righty then. Yes.
Look, I wasn't trying to come for
Yeah,
you.
well, you did, because now you got me subtracting 1953 from 1966.
That's the year I was born.
What, 1966?
Yes.
Oh, I was born 1953.
Yeah.
Oh, wow. So it really dates kind of goes back and dates back to when the formal Medicare was established. So CPT was established in 1966 by the American Medical Association in order for there to be an index or a coding system that would standardize terminology for doctors and the services that they provide. In 1983, and don't be concerned about the dates because I'm going to show you where they are in your book, but in 1983, the Healthcare Financing Administration, which is now called CMS, so the Center for Medicare and Medicaid Services. So for those of you who may have been in, working in, maybe billing or revenue cycle, if you've ever heard of HCFA, the HCFA used to be the Healthcare Financing Administration. They eventually changed their name to the Center for Medicare and Medicaid Services, or CMS. And then CMS adopted CPT coding, which was originally created um, under HCFA. And they also created a second set of codes for HCPCS level 2 for the drugs and supplies and things of that nature. So all of this wasn't always formally established. And you think about 1966, 1983, that really wasn't that long ago, to say that the U.S. is such a medically advanced country, but they did not have an advanced um, form of regulation as far as billing was concerned, even pricing. CMS is responsible for that. Like, what are we going to charge for this service? What are we going to charge for this drug? They are responsible for all of that. Not only do they pick what the fee is going to be for these services, but they also decide how much they're going to pay. Now, I myself feel like that's poor business practices, but therein lies the issue with our um, are pharmaceutical practices in the United States. The same company that sets the prices also determines how much they're going to pay and how much we're going to pay. There's a little bit more. There's more facts about the CPT book, but one thing I do want to point out to y'all is if you take a look inside the CPT book, just like how the ICD-10-CM book had labels in it, this book also has its own labels. So again, we'll spend some time doing that at the end. But just to explore it, a little bit before we get too far. The book is also broken out by, let me see. Turn to page, and I know the slide says one thing, but turn to page Roman numeral 13, which would be X. I. X 111, Roman numeral 13. And it should say introduction at the top. Everybody got it?
Yes.
Yes.
Perfect. Okay. So if you look at the first paragraph defines what CPT is. So if you had a question that said, what does CPT stand for? It stands for Current Procedural Terminology. What edition of CPT are we currently in? We're in the 4th edition. Because the books in the past look a whole lot different. They were definitely a lot smaller. And what's included in CPT is it's a set of codes, descriptions, and guidelines intended to describe procedures and services performed by physicians and other qualified healthcare professionals or entities. So when you hear qualified healthcare professionals, and I think we may have talked about this, that would include your nurse practitioners, your physician assistants, those of whom can see a patient and have the license to bill for their own services that they provide. It goes on, so that first sentence would be, actually that whole first paragraph would be highlight worthy. Sorry. If you also look, we're going to talk about the second paragraph, but you could also just kind of put like a one-line highlighter through that. Something else I wanted to show y'all. Oh, turn the page. That would be XIV as referenced on the slide. So that would be Roman numeral 14. Page 14, Roman numeral. So page 14 and 15 goes on to give further additional details about CPT. It talks about the section numbers and how the book is sequenced. So the order of the book, the very first thing when we start looking at actual codes, that first section of codes that we're going to look at is going to be your evaluation and management codes, which are typically the most commonly used because they're used for office visits, for emergency room visits, critical care, nursing homes. So those are the codes that are used the most often. So even though those codes start with the number 9, they decided to put that in the beginning of the book so it'll be an easy, quick find. So all of these pages, this page 14 and 15 talks about how the book is laid out. And these will be things that we also cover in the presentation as well, like how the book is laid out, who determines what the codes are going to be, what their descriptions are going to be, what surgery or procedure they're going to represent. And you'll hear me reference surgeries probably more than anything because surgeries are 50% of the exam. So if your exam is 100 questions, 50 of those questions are going to be surgery coding related. So that's why, the introduction of this course, or the first portion of this course, really does focus on, terminology, diagnosis, coding. But the latter portion, which is what we're starting now, from now until the remaining 14 weeks or so, is all going to be surgery coding. So that's going to be in addition to diagnosis coding related to that particular body area. So this sections or section numbers in their sequences, instructions for use of the CPT book, that is going to be a great place for you to reference after we kind of go through tonight, after you read the chapter. If you need to come back to this as a reference point on how to use the CPT book, that's always going to be there. Other things that are here that we'll talk about later, but I just wanted to kind of show you what that is, and then we'll talk about category 1, category 2, and category 3. Turn the page to page 16, Roman numeral XVI. Sure, my phone is on. All right, on page 16, it's a continuation of the introduction to CPT. So it talks about the guidelines, add-on codes, modifiers, all of which, again, we'll talk about more in detail tonight, but just wanted you to know where in the book you can find this. And then pages 18 and 19. Further introduction. So do we have a tab for that? So what I would do is take one of those blank tabs, one of those blank yellow tabs on the inside cover, and put that on the first page of the introduction, which is and put it at the top, on the top part of your book.
The yellow?
The yellow, yep, and put it on page page 13, the start of the introduction.
Where are y'all getting the tabs? You see on the inside cover?
Yeah. So, show you my book.
Oh, is it the cover from? I've got them on my HCPCS, but I don't have one on my. Oh yes, I'm sorry.
Are you in the yellow book?
Yeah, I'm sorry. I am
Okay.
confused.
No, that's okay.
You say put it at the top?
Yes, ma'am.
Okay.
The yellow tab goes. What page was that again?
13, Roman numeral 13. And that should be the introduction page.
Mhm.
Okay.
All right. So first thing I want to, okay, one more thing before I even get into category 1, 2, and 3. Turn to page 20. That would be Roman numeral XX. Because 10 is X, so 20 would be XX, double X. So page 20 is illustrated anatomical and procedural review. So this is another area where you're going to reference for help with medical terminology. It's a page that has tables of the meaning of numbers as it relates to medical terms. So like, mono is one. Like if somebody has mono, yeah, mono is one. Bi is 2, tri is 3. So that will be helpful for your numbers. What is going to be majorly helpful for y'all, and I want y'all to highlight this table, is the surgical procedures. So those you will definitely want to charge to memory. There's not a lot that I tell y'all to memorize, but this is one thing that you do want to memorize, and that is the suffixes for these surgical procedures. So it gives within that table, and I don't want to spend, just because I'm just kind of showing you the layout, I don't want to spend so much time on this yet because it will be covered in the presentation. So just make sure y'all highlight that and know that that is the place that you're going to go if you are given the name of a surgical procedure and you don't know what it means. So like, and some of these things, just because we're women or just because we may have had some things performed, surgeries, we know what it is. Like amniocentesis, you actually know what the procedure does or the purpose of it, but the meaning of the suffix is what is going to determine the type of procedure that was performed. So like a centesis is a puncture to puncture a cavity to remove fluid. So it could be an amniocentesis, like during pregnancy, to remove amniotic fluid. It could be an arthrocentesis to remove fluid from a joint, like from the knee or um, typically from the knee. It could be in like ectomy, the suffix ectomy. We talked about hysterectomy early on, but ectomy means surgical removal or excision, like to cut it out, to remove it. So an appendectomy would refer to the appendix. So as long as you understand what the suffix, you will already know what type of surgical procedure was performed. Um, those are some pretty common ones. It doesn't really start getting, I'll say, weird until you start hearing the ones that you're really not familiar with, like opexy, the suffix opexy, for example, which means surgical fixation. So like a nephropexy would be nephro meaning kidney, pexy meaning surgical fixation. Um, so that means that the kidney was mispositioned or what they call malpositioned, and they needed to suture it, stitch it back into place, reposition it. Sometimes that happens with women who may have had a hysterectomy and, maybe have what they call you can have a uterine prolapse, you can have a vaginal prolapse where it drops out of position. So they have to go back in and suture it or stitch it back in place. So just to give a few examples of some of how the suffix table is going to be helpful to you. So going back to medical terminology, at least if you are able to not just look at one long word like say amniocentesis, but at least be able to break it down. Like, okay, I know centesis means they're using a needle to pull fluid out. I know amnio relates to the amniotic sac. So you'll be able to kind of figure it out through your own thought process with that. Also, what you see on these pages 20 and 21 are prefixes and suffixes for conditions, for directions and positions. Um, and then it gives additional listings of where you can find certain illustrations or certain images. So it tells you, like, if you're looking for on page 21, where it has that list of anatomical illustrations. So if you're looking for a picture of the skull, like the skeleton of the skull, that's going to be on page 132. If you're looking for structures of the skin, that's on page 91, and you can reference that from, again, the list of anatomical illustrations on page 21. And it's a lot. There's also procedure illustrations. So if you turn to page 22, it also has a listing there, and they're listed by procedure code. So the surgery codes or procedure codes are 5 characters, always 5 characters. Um, Mainly, it's going to be 5 numbers, but occasionally there's a select group that does end with a letter, and we're going to talk about that as we go back to this slide to talk about categories 1, 2, and 3. And then if you look at page 24, and I'll stop there, page 24 has an illustration of the body planes. That may or may not be helpful to you as you're talking about directional things. So I'll stop there for now as far as the book is concerned so that we could talk about category 1. So category 1 CPT codes, those are going to be the main ones that we focus on. The 5-character numeric codes. There's over 7,000 service codes plus titles and modifiers. The codes are reviewed and updated annually by a panel that is established by the American Medical Association, and it is mandatory to report these codes for all services that are provided by a doctor that require reimbursement. So a doctor can't just tell a friend, hey, come on in here and I'll check you out. Nope. It's too many things that have to be recorded related to that visit. We have to track who comes in, who goes out, and everything has to have a record or a paper trail. So they can't just send their buddies in and, we assign a make-believe code. Everything has to have a code if a service was provided. So when we talk about category 1, we're mainly going to be talking about the 5-digit numeric codes, just the codes with numbers. With the exception of select few, but honestly, these codes are new, so we're not going to be spending a whole lot of time on a lot of that pathology stuff, just the surgical part, but that's like 10 chapters away. So the CPT code book divides category 1 into 6 main titles. So we saw this information back on page, in the introduction, back on page 14, where it talks about section numbers and their sequences. So again, this is how the book is laid out. First, with the evaluation and management codes, which range from 99202 to 99499. The anesthesiology codes, which are going to start with 00100 code range to 01999. And then there's 5 additional codes in anesthesiology section that are specific only to that section that start with 99, and that is 99100 through 99140. It's only 5 codes. The surgery section, remember I said surgery is going to be half of the exam will be related to surgery coding. So the surgery section ranges from 10004 to 69990. So we're going to spend a lot of time there, but what you're going to learn about the section is you will be able to recognize what body system or organ system the code is referencing, just based on the number that it starts with. So like the code starts with 1, I know that that's the integumentary system related to the skin. If it starts with 2, then I know that that is the musculoskeletal. I should know. Yep, it is. If it starts with 3, then that is either going to be respiratory or cardiovascular. So you can kind of, think about the relevance of the organ system according to the number. Skin is the largest, where I'm thinking about the surgery section. So all of your integumentary starts with number 1. The skin is the largest organ system because we have more skin than anything else on our body. We have more skin than bones, because our skin covers everything. So after the skin, is the musculoskeletal. That's our form. That's how we are formed by our muscles and our bones. And then after that, the respiratory and cardiovascular. So we have to be able to breathe and blood has to flow through our body. So if you kind of think about the sequencing of the sections, it starts to make a little bit more sense about the why. Codes that start with 4 are your GI, like your gastrointestinal. It could be stomach, intestines, colonoscopies. 5 codes are like your urinary system and your reproductive system. So, and then it goes on. But we will learn that over time. That is not anything I expect y'all to learn today, tomorrow, or 2 weeks from now. Um, it'll just come with practice, and before you know it, you'll start retaining stuff. Um, Now, while I do echo, the sentiment that I don't want y'all to focus on memorizing things, but if you do, because of the repetitiveness of you going through this, you'll start to memorize things, and that's only going to help you in the end. Um, Not to memorize every detail, but to memorize the foundation of coding, as far as the layout of the book, which is most important, because that's going to be your biggest time saver, knowing that book. So radiology section is the 70,000 code section. All of those codes start with 7. So that's 70010 to 79999. Your pathology codes start with 8, and then your medicine section codes will also start with 9. So it's different than the evaluation and management, but the medicine section is listed in the back. So, taking a look at, again, further layout of the CPT book. So let's go to page, just kind of following the slide. Let's go to page 95. So,
Did y'all put a tab down with evaluation and management, or
say that one more time.
what did y'all put a tab down with evaluation and management? Did I miss that?
You can. I haven't gone over any other tabs yet, but you can since you're
Okay, I
already
was just wondering
there.
if I missed that because I was just because it's the color before the blue, that we're going to. So okay. Don't worry about the tabs, right now.
Not yet.
Okay.
Not yet. All right, so on page 95, because I really want y'all to understand what the book looks like. So, we talked about the main sections, right? So the main sections would again be those that are listed on Roman numeral 14. So that would be your, let me just check, your evaluation and management, your anesthesiology, your surgery. So this is an example of a CPT, or on page 95 where we're currently in the surgery section. So if you look up at the top of the page, it tells you that top right. So the top right says that we're in the surgery section. And then it has that backslash and it says integumentary system.
Mm-hmm.
So that's our subsection. It's telling us that we're in the surgery section and we're in integumentary system. And then it also gives you the range of codes that are currently on that particular page. So on page 95, you'll find codes for ranging from 10040 to 11005. So that's going to be a key indicator of you being able to search for your codes that way in this book.
Okay.
Also, if you take a look at page 95, you see that there is actually, I'm sorry, on page 94, because that is actually the start of that section. So page 94 tells us up at the top again that our subsection is the integumentary system because it's in green. And then we have a subheading in red just below that. So you don't necessarily have to remember like, oh, this is the section, this is the subsection. Just understand what you're looking at. So know that you're in the surgery section, that we're looking at the integumentary system, and that currently the codes that are going to be listed below this subheading of skin, subcutaneous, and accessory structures are going to be in relation to this particular surgery system or organ system of the integumentary. So under skin, subcutaneous, and accessory structures, it now tells you that our category is introduction and removal. So the codes that are under this particular category, introduction and removal, which there's 3 codes, 10030, the 10035, and 36. Those 3 codes are all related to introduction and removal of things that would go into the skin or subcutaneous tissue of the integumentary system. Next page on 95, same thing. That is a category of incision and drainage. So that means that all of the codes that are listed under incision and drainage pertain to that particular service that is being performed on skin, subcutaneous, and accessory structures of the integumentary system. And then one more time with the section of debridement, or the category of debridement on page 95. That is debridement procedures performed on skin, subcutaneous, and accessory structures of the integumentary system. Also want y'all to notice on the edge of each page how it has in green integumentary. So it's another reminder of what organ system you're currently in, and the code range for that entire organ system. So 10004 to 19499. And it'll make sense shortly. So if it's not making sense yet, just give it some time. This will be very similar to when y'all had your first night of diagnosis coding. You were like, what the? But now you get it, right? So, so page 247 talks about specific guidelines. So just like in our ICD-10 CM book, you are going to have guidelines for this book as well, but the guidelines, instead of being all in one section, like in the ICD-10 CM, it was all at the beginning of the book. And this book is kind of like all throughout the book. And the codes, the guidelines are going to be related to each section. So page 247 real quick. Notice that on page 247, so at the top, same layout as what we just looked at on previous pages in integumentary system, but this time we're still in the surgery section, but organ system is cardiovascular. The codes start with the number 3, and on this particular page they range from 33016 through 33130. So 33016 is the first code on this page. 130 is the last code on this page. Now, what you see in the first column of page 247 is the guidelines for that section. So it's telling you, that these are selective vascular catheterizations, and they should be coded to include, it's giving you the details of this particular section. You don't need to go through the details at this moment, but this is where you're going to find your guideline information. So a couple of things about the next category that we're going to look at. So that's in a nutshell, because we're still talking about category 1, 2, and 3. So in a nutshell, that's category 1. Category 1, to sum that up, is going to be your 5 numbers that represent a procedure or a service performed. Category 2 is going to start on page 'll be after the medicine section, so it's going to start on page fingers to work properly. Page 851. I'm gonna tell y'all the only thing you need to know about category 2 codes is that we call these the F codes, meaning, well, wait a second. Highlight that very first sentence. So this section of codes contains a set of supplemental tracking codes that can be used for performance measurement. The only reason that these codes are used is for internal tracking by the hospitals or facilities. So in lines of billing for the services that the doctor provides, they are not useful for that at all. So we like to say F these codes because we don't have to worry about coding them.
Okay.
I didn't say it, Ma Kathy.
No. Oh, I thought that F word was something important, but I understand it now.
Always is. Always is.
yeah, I got it now. Okay, yeah. Okay, do not worry about it.
So all you really need to know is that these are codes that are used for performance measurements. That's it.
We're not going to be tested on them then. And
Not at all. Oh, you just need to, you may be tested by saying what codes are used for performance tracking. And that would be category 2 codes or F codes. They're not used for billing for services, and the whole premise of this physician coding course is to bill for physician services. So anything that is not that is not necessary to cover. AEPC only covers what we need to cover to pass their exam.
Okay.
All right, so I do not need to further discuss category 2. Category 3 codes are what we call temporary codes. So that is on, and there is a tab, sorry, let me back up. There's a tab for the category 2 codes. If you want to go ahead and put that tab on page 851, put it up across the top, only because it's not going to be a place that you'll have to reference a lot or at all. If you can memorize that these are the performance tracking.
let's see. The yellow ones too, or?
No, there's a tab that actually says category 2, and it is red.
Yeah, the red.
And then you can grab that category 3 one while you're there. Category 3 codes are temporary codes. Those are on page 873, according to the, yes, 873. Couple of things I want you to highlight there is that first paragraph and the second paragraph. So the reason that we have T codes, and I'm summing this up in the most simplified way, the reason that we have the T codes / temporary codes, and you'll know that they're T codes because they end with the letter T. It would be like 4 numbers and then the letter T. They are surgeries or procedures that do not have a permanent code assigned to them because they're new. New technology or technologically advanced services and procedures. Like a lot of these robotic procedures don't have um, its own CPT. It's kind of like Pinocchio when he was looking to become a real boy. So the T codes are looking to become real codes. They are only used if there is not an appropriate CPT code to represent the procedure that was performed. And so what happens with these is they will go CMS tracks how often the temporary codes are billed, and they review the data from that twice a year, once in January, once in July, and they will determine based on how often a particular T code is used if it needs to be turned into a category 1 code. So the category 1s are the ones that are billed all the time. The T codes are only used if there is not an appropriate category 1 to represent the procedure. That would be because it's a new procedure or a new equipment that they're using that they've never used before. So it does say if a category 3 code is not available, then we would report in a category 1 unlisted code in its place. But we have to first talk about what the unlisted codes are. And we will.
The category 1 code, did I miss? I don't know. Where was the category 1?
Category 1 is is the first large section. So category 1 starts with the evaluation and management section.
Okay.
And it goes through to the end of the medicine section. So literally pages
Is that surgical? No.
page 1 through 850, that's your category 1.
Thank you.
Was there a code for that one? I mean, I'm not a code, but a sticker, a tag.
Yeah, there actually is. And so you can put that category 1 sticker across the top as well on page 1. Regular number 1, not Roman numeral. All right.
Y'all just marking that with a white and a yellow too?
No, there's a red tab in there for it.
For category 1?
Mm-hmm. Is there?
I don't see one.
I don't see one.
Oh, okay. Probably because it's not necessary. As long as
Okay.
you know that that whole first section is category 1,
Okay.
and you know the difference between categories 1, 2, and 3, you're good.
Would you use the other yellow one or just to
It's
go
not
so we can
necessary
put the guideline?
because you may need that other yellow one for something else. All right, let's go back to page 95 just so we can kind of look at what a CPT code looks like.
95.
Page 95. So remember how we had the index to diseases in the alphabetic index? We have something similar in this book. The book has an index, and it's in the back of the book like a normal index should be. and it looks like a normal index, meaning you can go back there and look up a word and it'll kind of guide you on where to find that. Um, but typically, when you're looking for your code, your index would be the place to start, but it's going to send you to um, that particular section. Like we're on page 95 in the integumentary um, area of the surgery section. So it's going to, once you go to the index, it'll reference you to go to a particular code. It's not going to give you a page number. It's going to give you a code to find. So we're on page 95 and we're looking at two CPT codes. A key to understanding your CPT code is going to be fully reading and analyzing the description of that code. So again, we're in the integumentary, which is the skin. And the particular codes that we're going to look at are 11000 and 11001. So the first code, 11000, is representing, because it's under the subcategory of debridement. And a debridement is a surgical procedure that they perform when they are um, having to cut away dead tissue until they find viable living tissue to help with wound healing. So, like if somebody, has a burn or road rash or, some type of wound on their skin that's not healing, then a lot of times what the doctors will do is they'll do that debridement to cut away or shave away. There's a number of different ways they can do it, but they'll remove the dead skin tissue until they get to an area where it starts bleeding, because if it's bleeding, that means the tissue is living. And that's what they want. They want the wound to be able to start to try to repair itself. Anyways, the code description of debridement 11000 reads debridement of extensive eczematous or infected skin, and then it has a semicolon. So a couple of things about that. This is going to be your determining factor of, do I have the right code or do I not have the right code? So you're going to look at the procedure being performed, which is a debridement, where it's being performed, which is or performed for what reason, which in this particular one, it gives the details in the description of extensive eczematous or infected skin. So this code will be for somebody who has had a debridement for this purpose. And behind that semicolon is going to be ultimately, again, more of your deciding factor. So this code represents up to 10% of the body surface. Now, remember the indentations that we saw in the ICD-10 handbook? Same type of concept. So if you see a code like this and then a second code under it that has an indentation, then that means it is a part of the previous code, meaning that anything before that semicolon is going to be a part of this description in the second code. So that second code of 11001, if you look in your CPT book, it says it is for each additional 10% of the body surface or part thereof. And it says list separately in addition to the code for the primary procedure. So you have a code for the primary procedure, and you have a code just below it that is indented, meaning that it's getting a part of its description from that first code. So 11001 would be description of, debridement of extensive eczematous or infected skin, semicolon, and then second code, semicolon for each additional 10%. Because the first code represented up to 10%, right? The next code is going to be for each additional. So if this patient had a debridement on 20% of their body, then you would report the codes 11001, comma, I'm sorry, I totally messed it up. You would report 11000, comma, 11001, and that would represent having both of those codes would represent 20% of the body area. So if I lost you, where did I lose you?
So by using that second code, because it increases the coverage of the body, 10% more, you'll use the 11001 before the 11000. That's how it would be.
No, you would do. Where's my chat box? Hold on. Let me type it for you how it would be. So if you can see the chat box,
Mm-hmm.
it would be 1-1. So again, the patient has had this debridement procedure performed on 20% of their body.
Right.
So you would report the first code 11000 to represent the first 10%
Okay.
of the body surface.
Okay.
And then you would report 11001 to represent the second or additional 10% of the body surface.
Okay, so if it's 30 or 40%, you would just repeat that 11001 that many times?
Yes.
Okay.
And even, good question. So even if it was, let's just say 14%. So if it was 14% of the body area, you know that your first code would represent up to 10%, but you still have to find a way to report the additional 4 that was done. So you can still report 11001 secondly.
Okay, so even if it's, all right, hold on, because my wheels are turning.
Mm-hmm. Yeah,
so from the additional 10% to the 20%, no matter what the number is in between there, you would still use the 11001, no matter if it was 14, 15, 16, 18.
Or 20, correct.
Okay.
But then once it hits 21, 22, then you would need an additional code to represent up to the next 10%
That's
of
interesting.
the body surface.
But that 11000 will always be the first code.
Correct.
And then okay.
And another reason that you know that, y'all are asking perfect questions for great segues. So another reason that you know that is because the second code has a plus sign in front of it. And that plus sign means that you always have to use it in conjunction with 11000. So this is where parenthetical notes come in, or parenthetical instructions. There'll always be some type of note in the parentheses that's going to help you decipher how to code this. So in ICD-10, we had the tabular list, right?
Mm-hmm.
We don't have the tabular list here, but we have parenthetical instructions, which are just notes in parentheses that help us with the coding.
Okay. Okie dokie.
Oh, go ahead.
So I noticed when you typed it in the chat, we don't have to include that plus. That's just to let us know that it's coming after the first code. Okay.
Right. And we call the first code the parent code. Just like the parent and the child, like your children that's your +1. So we call that the parent code. Yeah. But that is correct, Princess.
Thank you.
You're welcome.
And for the practical application test, we just got to make sure we put a comma between those two.
Yeah, but it's still it still may grade it a little wonky, and I'll still have to go in and hand read those.
Yeah. Yeah.
So don't be alarmed if again, if all of your answers are marked incorrectly, because I'll have to go back in and grade it. So everybody understand the concept of the semicolon, that the semicolon, any data after the semicolon could be subject to change, or the information in that code could change your code selection. Like we saw here, where behind the semicolon it said up to 10%, and then here it said each additional. And we'll see more examples. This one is looking at some anesthesia codes. So let's take a look at page 78. Same thing. It's kind of just, this is just kind of helping you understand the logic behind the semicolon once again. So page 78, we're looking at anesthesia codes. We start with a CPT code for anesthesia of 00160, which is in that first column. 00160 is anesthesia for procedures on the nose and accessory sinuses not otherwise specified. But we see a semicolon, right? So the key thing is going to be always pay attention to the details after the semicolon. Because this semicolon means that this first code was for not otherwise specified, but this next code that is still a part of this family, because you got 016, 00160, 00162, and 164. So there's that indentation again, where 00162 is anesthesia for procedures on the nose and accessory sinuses for radical surgery, but 164 is anesthesia for procedures on the nose and accessory sinuses with a biopsy of the soft tissue. So if you didn't have the details of radical surgery or biopsy, then of course your only option would be to select this code, the first one, 00160. But if you had the additional details that told you that it was, yes, it was a radical surgery, or if that told you that, yes, we did this procedure and we also did a biopsy of the soft tissue, you know, you have more code options, the more details that are given.
Gotcha.
But is everybody able to look at their book and understand the indentation
Yeah.
of the previous codes to the next code?
Yes.
Okay. Everybody
I
else?
think so.
Yes.
Okay. It'll come with practice for sure. All right. Page 99 and 100. Very similar to what we looked at in the example with the skin debridement.
Oh,
So this is looking at focusing again on the add-on codes. So this goes back to that plus sign that you asked about, my Kathy, and also just kind of looking again at another example with the indentation. So we have 11200, which is removal of skin tags, multiple fibrocutaneous tags, any area, up to and including 15 lesions. So if anybody has ever had skin tags removed, you know it could be a little or it could be a lot of skin tags that they remove. So this first code represents up to 15 lesions or skin tags. So you'll find with the skin section, they use the word lesion loosely. And then there's an add-on code. So 11200.
So is it?
So actually, page one. Oh yeah. Okay, 11200 is on page 99. And again, that is removal of skin tags up to 15 lesions. Then if we turn over to page 100, There's the add-on code, which has that plus sign in front of it, and it means that this code can only be used in conjunction with 11200, right?
Yes.
So that add-on code represents each additional 10 lesions or part thereof. So if somebody had 25 skin tags, then we would need to report both 120 and 120. Questions?
So 10 for the first one, and then 10 more, but then there's still 5 left. So would you not do 11201 twice?
Well, if there were, and that's where your math skills would have to come
15,
in.
I'm sorry. It's
Well,
15 and then 10.
If there were, ask your question again. I'm sorry.
I understand now. I was thinking 10 and 10, like it's like 10%
Oh, okay.
versus the 15. So it's 15. That's why. I was doing the math wrong. Okay.
Okay.
So if it was 30, for instance, we're going to put down
Yeah,
1,
then
2,
you would
1
need-
twice.
Yeah. Yeah.
Okay.
Absolutely. All right. Anyone else have any questions?
I guess that's because of every 11201, they're going to just make it more money, right?
Exactly.
Is that why?
Well, that would be the intent. That doesn't mean that the insurance companies are going to pay, but just the intent would be to make more money. Only if it's medically necessary. So remember we talked about medical necessity? Yep, that still applies.
I still don't know if that would that necessarily be a necessity? How do they decide that?
It would all be based on the diagnosis as well. So if the doctor diagnosed that the patient had, 30 skin tags, they were going to remove 25 of them, they wouldn't leave the 5. They would just remove them.
They all have to be biopsied.
Yeah. Yep, you're right. Which means more bills, because then they're going to get a separate bill from the pathologist. So, looking at some additional things here with CPT coding, conventions and icons. So again, a lot like the ICD-10 CM book. The book had symbols in it, and the symbols represented certain things. Everything you need to know about the symbols in the CPT book, you're always going to find at the bottom of the page, every page, not just one page. So if you look at the bottom of page 100 and 101, even though it's giving different page numbers here on the slides, but since we're already on page 101 and 100, we can look there. So look at 101 first. So that you can see the blue triangle, the red circle, the 2 triangles pointing at each other all mean something. The blue triangle means that you have a revised code, that the code was changed in some shape, form, or fashion. And we can look to see what the revision was, but we just need to know that it was changed. The red circle in front of your code means that it's a new code that was added to the book this year. The 2 triangles pointing at each other means that that the code contains a new or revised text. So maybe sometimes it could be just as simple as maybe the word was misspelled in the CPT book for a whole year, and they updated it. So now the text is revised on that code. There's other abbreviations down there. All of them may not mean a hill of beans to you, but definitely these first 3, just be able to recognize what those are, what they represent. Let's skip that. The circle with the line, huh?
I was looking at the PLA part going, what does that mean? What is that supposed to?
Oh, that's for pathology, laboratory medicine. It just means that That symbol just represents that it was a duplicate lab test, because some tests can be in a lab panel, where the panel would be multiple procedure codes, depending on what they're testing in the blood, or it could just be an individual test outside of the panel. So they'll put that symbol there for us, on as we're coding, just to know that it's a duplicate code. The circle with the line through it means that you cannot use a modifier 51 on this, but we'll talk about modifiers in a bit. You gotta baby step it. The lightning rod is those that are for vaccines that are pending FDA approval. So don't let people out there in the street that think they know everything there is to know about COVID or the flu, any new thing that has gained political momentum, just because the nature of things, with COVID. Anything you need to know about healthcare, you can find out through the American Medical Association accurately versus, searching Facebook or other outlets like that. So if you have a lightning rod in front of the vaccination, then it is approved by the FDA. If there's no lightning rod, then I'm sorry. If there's a lightning rod, it means that they are pending FDA approval. But if they're pending approval, they could still be used. Once they submit that application for approval, they can still be used. They don't have to have full approval from the FDA. The FDA is the Food and Drug Administration, so same people that says that we can eat ground beef that has been cleaned with bleach are the people that say, we can take all these vaccinations. Think about that.
Mm-hmm.
Or does it stop us from eating ground beef? Not all of us.
I don't eat it.
And that's why you look amazing at your age.
I don't eat it. Now, thank you for saying that.
Cpt Conventions and Icons additionally. So there's others, and I don't necessarily have to spend so much time on them because they're not going to mean much to you. This one is new, and this star symbol means that the service can be billed as a telemedicine, or what they call, it can be billed for a virtual visit, but the true meaning is telemedicine, and that we have to report it with a modifier 95 to state that it was a service that was provided to a patient outside of a medical facility. But we will talk about modifiers. CPT Code Basics. Take a sip, sorry. So to select your CPT codes, and remember that there's instructions on how to use the book. The front of the book. Just 1 second, y'all. All right. So reviewing a medical documentation thoroughly and gathering additional reports is the best way to select your code, but versus reading through these slides, I'm gonna just show y'all myself. Okay.
Okay.
Let's go to sometimes the PowerPoint presentation can get a little dry and boring, and the best way to do it is to just get in there and do it. So that's what we're gonna do for the next few minutes.
What page is that? Oh, okay, 1182.
Yeah, it's 1182. So the first thing that we are going to try to code right now is we're going to code a biopsy of the ovaries. So let us and this is going to be a laparoscopic biopsy. So biopsy. Laparoscopic meaning that they had to use a trocar which, oh, let me back up. Okay, laparoscopic procedures are minimally invasive. This is where they most of the time have robotic assistance. They will robotic assistance, meaning the doctor is operating the machine and using the robotic hands to perform the procedure, because it's best for the outcome of the patient and it helps us heal faster instead of them making like one long incision and opening you up and then having to stitch things back. So go to the index. The index is what you need to see. Our index starts on page 1028. And before we go to page 1182, I just want to actually, the index starts on page 1027. And you should have a tab for the index in the front of your book.
What page you just said the start of the index is?
1028, and there's not a tab that says index, so take one of those yellow ones. So
Yes, there is.
where is it?
Light blue.
Oh,
It's light blue.
Okay.
Oh, it sure is.
sorry, I missed that.
Somebody got some good eyes.
That happened. Was that Princess?
I think so. It sounds like her.
Yeah.
It sounds just like
All right, so the index is going to be very, very helpful to you as well. Once again, I mean, there's just so many different areas of helpful resources, but this index really does, give instructions again for the use of the CPT book, but that's also in the front. And it tells you how to use the book. So remember in ICD-10 diagnosis coding, you have to search in the alphabetic index for the condition. And that's the only way you can code it. Well, this book is a little bit different because you can search by your main term can be your procedure or service. It can be the organ, it can be the condition, or it could be an abbreviation, like a synonym for that procedure. In this case, we are going to go to, now we're going to go to the index. So in this case, we're going to go to the index and we're going to look up ovary. Now, there is no rhyme or reason to when you would use versus the organ or the body part versus the abbreviation. So that again is something that would kind of be determined and that you'll kind of get the hang of the more you use the book. And it does vary per section. So let's go to ovary in the index. And I just want to kind of see where
okay.
case says.
On page 1182.
Yeah. Takes us to page 1182.
Okay.
And we are coding for a biopsy. So that's our example. Biopsy of the ovary. That's all we're coding. Biopsy of the ovary. So if you're looking at page 1182 and you're under ovary, you can see how the index is set up by everything under ovary is well, the index is alphabetized, but under ovary is in alphabetical order as well by procedures, or conditions relating to the ovary. So under ovary, we're looking for biopsy. And under biopsy, it gives us two codes, right? It gives us 49321 and a comma, and then 58900. So now, once it gives us two codes, if it's two codes separated by a comma, that means we need to figure out which of those two is going to be the appropriate code for our biopsy, right? So let's now go to look at the first one, which is 49321. So this is going to have to be kind of like the part to where you say, okay, I got these two codes. And I myself, I used to write things down a lot. So like I would never remember 49321 and 58900 would be the codes that I need to go back to because read the code description. So I tend to write things down just so I could, or maybe have like your finger or something where you can hold the page down just in case you need to reference back to it. But go to page 449 so we can look at 49321 and read the description.
Go to 49321, but how do you do that? Because it's not in order.
Is laparoscopy?
Well, are we on page 449 or 1182?
It's on
No, actually,
1182,
it's
but you said
page.
go to 49321.
Hold on. It's page 396.
Mm-hmm.
So it's just the
Laparoscopy.
The page number is off on the slide. That's why I don't like using those page
Okay.
numbers.
Okay.
They were good up until that point.
Uh-oh.
But page 49321, I'm sorry, CPT code 49321. So you always want to rely on searching back by your code.
Okay.
So the code description for that, first, just above that, under laparoscopy, it does have some guidelines for you to go by there. But let's just look at the code description first for 321, which it says laparoscopy, surgical with biopsy from a single or multiple. So that means whether there was one biopsy, two biopsy, three biopsies, this code would be suitable for a biopsy of the ovary. Now let's look at 58900. Because we have to determine which of those two codes would be the most appropriate.
Is there a good way to find this 58900?
Just by looking at the numbers at the top of the page to the numbers in the top right, or just how the codes are sequenced. That's going to be the best way. But of course, this being your first night, you're not going to be familiar with the book right away.
So can I ask a quick question?
Sure.
So on that page 396, that 49321, that's the surgery part of it, right?
Yes.
Okay. And then
So what we're looking at here is we're trying to decide, because when we went to the index gave us two codes. So we have to decide from these two which one is the right one for this example. And the example is laparoscopic. We're going to go with laparoscopic biopsy of the ovary. So if we look at these, 49321 in its description said laparoscopy, surgical with biopsy. And then 58900 says biopsy of ovary, unilateral or bilateral. So now, when we look at laparoscopy, does it tell us what is being biopsied there?
It does. It says for laparoscopic biopsy of the ovary or fallopian tube, use 49321.
Okay. But does it tell you that in the book?
Mm-hmm.
It says if it says biopsy of ovary, then that's all you need to see.
Unilateral or bilateral. It says separate procedure in parentheses.
Okay. But
It doesn't mention the ovaries though.
right, that's the point I was trying to get to. So 49321. So if we're looking for the code for ovary,
What,
see
it,
what
it
this
doesn't
says.
say
This
biopsy of
contradicts.
ovary biopsy.
And nobody don't mention ovaries though. Just mention the surgical part.
The thing that I want to point out there is
Oh, that's tricky.
hold on
That
a
was
second.
tricky. That was tricky.
Still not.
I'm looking at the index and I'm thinking both of them are right, but no, that's not. That's a trick. Mm-mm. So you can't use both of those codes, right?
Mm-mm. Hold on a second.
Okay.
No, you can't use both.
You can use one or the other. The index just tell you where you can go.
Right.
Okay.
But you have to decipher.
Right. Which one is? Yes, I got you. Okay.
So actually, the
Oh,
one
okay, I
49321
got it.
doesn't say anything about the ovary.
Hang tight.
Okay.
So our options are 49321 and 58900. So now, if we're coding this laparoscopically, we would have to go with 49321. Why? Because laparoscopic means that they had to go in abdominally, right? Through the abdomen. If we were coding it as an open procedure, open meaning no small incisions, they had to do a large opening, no robotic arms, no robotic assistance, a full-blown open procedure, then we would, and the ovaries were being surgically removed by them being cut out, then we would use 58900. Because 58900, you got to look at the full headings and subcategories and things like that. So it is of the ovary, however, it is an open procedure. It's an open procedure.
Because it doesn't say lateral. I mean, lateral.
It doesn't say laparoscopic, but again, you would look at your parenthetical notes, your parenthetical instructions in the parentheses. It says for laparoscopic biopsy of the ovary or fallopian tube, use 49321.
Where do you see the parenthetical?
If you look at CPT code 58900, it's there.
Yeah, it's right at the top. Right under laparoscopic. Laparoscopic. Yeah, I see that. Okay.
Yeah.
All righty there.
CPT code.
All right. That's so.
There's something I'm missing.
So you should be looking in the book at page 449 at CPT code 58900.
Okay. 58900. Okay. And then you see, okay, in the parentheses, is that what you're saying?
Yeah, just below that. So anytime you see parentheses under a code, that is your reference. That's your guidelines. That's just like your tabular list. So just like the tabular list would tell you, to use an additional character or that you need an additional character, the parenthetical notes is telling you how to apply your CPT code.
I'm trying to go, okay. Go ahead.
So,
what is the clarification?
Yeah, what code is it? 49321?
Yeah, it's going to be that one.
So you don't use 58900 at all?
So is the excision
58900 would only be used if it was an open procedure.
Okay. So excision is to cut open?
Yes.
Okay.
49321.
Laparoscopic. What is laparoscopic?
Laparoscopic is when they, instead of doing one open procedure with a large incision, They would
Yeah.
make 2 or 3 small incisions for portals and be inserted to,
Okay.
and they would use the portals, what they call portals, trocars, or robotic assistants, meaning that they can insert these arms into the small, and when I say small, they're literally like tiny stabs, just long enough for a little tube to go into.
Okay.
So that's what laparoscopic is. So it'll be a good idea. It'd be helpful to y'all to get the visuals of these things, like the different types of procedures, like as you're going through and studying, to maybe go on YouTube and look up, laparoscopic biopsy of uh, ovary. So you can kind of catch the visual on it. That is another way that we didn't have YouTube, but I used to order DVDs and things like that of, videos that I could watch that would help me to learn a lot of these things. Because I'm a visual learner, so I kind of have to see.
Certainly helps.
So the next thing that we're going to talk about is modifiers, and we'll probably end at about 8:15 ish or so tonight, because I want to make sure I get enough time for the video to upload. But anyways, modifiers. So what are modifiers? Because y'all have heard me say modifiers. So modifiers are, well, a couple of things. Let me back up. This book is loaded with appendices, which is the plural for an appendix. And in the appendix is going to be things that are going to be helpful for your coding, but also necessary for you to know how to apply. So, remember in diagnosis coding where we talked about laterality, like, making sure in your ICD-10 CM code, you had to identify, if something was the left or the right, um, and identifying the laterality. Well, same CPT has the same type of system, but what CPT has is modifiers. So a modifier is characters that will modify or make modifications, enhancements, so to speak, to your code that provides additional information. Um, so say for example, that example that we had with the ovaries. If it was a left ovary, we would have to add a modifier that designated left. If it was a right, we would have to add one that designated right. And if it was on both sides, then we would have to have one that designated bilateral. So to catch the visual, turn to the inside, your inside book cover. So there's a couple of different places you can find modifiers.
I mean, on the back or the front? Common.
Modifiers on the inside book cover. So there's several modifiers, but there's some that you're going to probably use more frequently than others. Um, so if you look in that first column, it has symbols, the same symbols that we already talked about that are also at the bottom of all of your pages in this book. But the modifiers are there. So in particular, I want to look at that first list of modifiers in the first column. So those can make changes or amendments to your codes. So say for example, here's a good example. If someone has surgery, right? Let's say a knee replacement surgery, but they also have congestive heart failure. Chances are there's going to be an orthopedic surgeon performing the surgery, the knee surgery. And then there's going to be a cardiologist there to monitor the patient, or the anesthesiologist will insert a catheter to help monitor the patient's heart because they have congestive heart failure, which would be an increased procedural service, right? Because they had to do more for this patient because of the conditions or comorbidities. So in that case, we would add that 22 to the procedure code. So like for the knee procedure, I want to say it's 2, 3, 4, 4, 7. And they would add that 22, kind of like how you see how I have it there. Actually, 2, 3, 4, 7 would be, if it's the left knee, 22, something like that. Because you can have more than one modifier. It just depends on the scenario. So modifiers will be a concept that you'll kind of have to really get adjusted to and learn. But the biggest thing is remembering to identify with your modifier if the procedure was performed on the left, right, or bilaterally. So here's another example. This is a breast biopsy procedure code. So if it was of the left breast, it would look like that. And this is by needle. So when you put the hyphen, you don't have to put a space behind it. If it was of the right breast, it would be 19083 RT. And then if it was bilateral, it would be 1908350. So where I'm getting the modifiers from is, again, from that inside cover of your CPT book. There's another place that you can also find modifiers, and that is Appendix A. So that takes us back to page, takes us back to page 917.
Okay.
So there's a label. What do you call it? The tab. There's a tab for page 190, page 117. I'm just making up words. Page 917.
APPA, appendix tab.
Yes.
Well, I got APPA to B. That's what I need to use.
Yeah.
Okay.
Yep. And you can put that on the left hand, I'm sorry, on the right hand side of your.
On the right hand side where? Okay.
Of the page.
Instead of the top.
Right.
Okay.
I got you, Shields. I got you.
Thank you. I know.
You're welcome.
You catch me. I'm kind of like,
I got you.
I'm not sure if I did put like the integrity. Did you put the anyway? How many tabs do y'all have right now? How about that?
We didn't do any of the surgery tab, Shield.
We did.
I did 2. Maybe I
Yeah, I think we just did like category 1, category 2.
Yeah.
I think that's all we did. Yeah, I didn't want to just kind of use up all our time with the tabbing tonight. I really wanted to get into some of it. But that is the basis. I mean, there are a few more slides. The remainder of the presentation talks about each modifier in detail. We don't need to do that. It also talks about some of the other appendices in the CPT book that you'll never ever use, or you may use pertaining to specific sections, like when we go over chapter 20, chapter 19, and I think it's chapter 16 as well. So we can touch base on those at that time. I really just wanted to make sure everybody got a good understanding of the CPT book first. And then I'll talk to y'all about the HCPCS book. So any questions that you see related to the HCPCS level 2, you can go ahead and skip it for now. But what I am going to do is I really do want to try to touch base with everybody this week just to kind of see where your level of understanding is with the diagnosis coding and kind of see what we need to do to enhance that. But there are some diagnosis coding practices in this week's homework. So did anybody have any questions in regards to maybe chapter 5 that we didn't get a chance to talk about earlier before starting this? And if you do want to, as I said, I'm still really encouraging, everyone to try to get with me. I know all of our schedules are busy, but if we can try to get that, make that happen within the next 2 weeks,
Okay.
I would love to do that.
Okay.
All right.
Any questions before we leave tonight?
We are good.
You good?
No?